Not being heard by your doctors is something that's common for everyone. However, for populations that face health disparities, it's a higher rate of the doctors not listening. Particularly with breast cancer, Black women have reported in studies that they have had less quality of conversations with their doctor than white women. Black women are 41% more likely to die of breast cancer than white women. And I believe some of that has to also do with the conversations with the doctors.
We know based on studies that as much as 80% of the diagnoses can be made just based on the story, based on your illness, the course of that illness. But we also know that because of the lack of time that doctors have to spend with patients, that doctors can interrupt patients in as little as 10 seconds into that story. Now, this is not based on bad intention, but it is based on the system that we have that does not prioritize time and the doctor-patient relationship. And there's also a over-reliance, I should say, on testing instead of listening and hands-on experience with the patient. And so all of that makes it such that that miscommunication is more likely to happen.
The conversation between a doctor and the patient, it's a two-way conversation. And sometimes we don't see it that way. I really recommend to patients to prepare for the meeting with the doctor and treat it like a business meeting. What are your goals for that meeting? What questions, concerns do you have? And then who's going to be in the room with you? Because I'm a big believer of having someone there to take notes and someone who knows what your goals are, because they may be able to advocate for you.
What I say to patients is that you are the expert when it comes to your health, and the doctor is the expert when it comes to medicine, and that partnership is really essential. And so practice a 2-minute version of your story, a 1-minute version, and a 30-second version. Give the chronology, what began first, what happened next. Provide context. If this is the worst headache that you've ever had versus this is something that you experience almost every day, make sure to talk about it. Know that you only have a limited amount of time with your doctor. Come with questions. Speak up and ask those questions. Talk to your doctor together about what is the most likely diagnosis based on what they've heard thus far, and what is this not. You can always emphasize how different this is to you compared to before. That kind of comparison is important because your physician is not going to know how you normally are. You might look fine, but maybe you walk in and say, I used to run marathons, but now I can't even walk 2 blocks. That certainly gives a level of context to who you are and why this is so different for you.
The other thing is, if you have any data, so you may know your family history, you may know your risk factors. So if you're trying to get a screening or an exam or approval on something and you have that evidence and that research, share that with the doctor, because they may need that information to get approvals from insurance as well.
Always seek a second opinion. If what your doctor's saying doesn't make sense, if you feel like you're not being heard, don't wait to have somebody else review your situation too. A lot of times the diagnosis isn't immediately clear. Maybe it requires further testing. Maybe it also requires more time for the doctor to figure out what you have. The time to seek a second opinion is if you feel like you're not getting better, if you feel like the tests that are being done don't make sense, if you feel like your doctor isn't hearing you out and their answers are not satisfactory. In that case, you can ask for a referral to a specialist if that's appropriate, or you can go seek out a second opinion on your own. In general, more information is better, and you should find someone that you can really trust.